I often ask myself how my mom adjusted so well to a life that was very different. She grew up in a rural village of 250 people where our family has been making wine there and living in the same houses for about 11 generations. And I was very lucky. I got to go there every summer and I kind of felt like I had a foot in two different worlds, right? I felt like another planet. It was a really stark contrast to my very nice, but very car dependent suburban hometown. And when I was a kid, there were only 5 channels on TV and there were cows in the streets and cheese was sold by horse and buggy. And I played with my cousins in the streets because the streets belonged to us and not to the cars. And it was quiet and peaceful and the air was clean. And I was really lucky that my parents took me to European cities with vibrant streets filled with people and outdoor life instead of polluting vehicles. And even as a kid, this just felt like a happier, healthier, more communal way to live.
From Coordinate Sport, it's the Drive Phase, a show about sports founders, leaders, and experts, and the stories behind their business journeys. Our guest this episode is Natalie Draisin, the director of the North American office at the FIA Foundation. Natalie has grown her career in global public health and road safety, culminating in her current role with the foundation. As one of the youngest and often the only woman in her sector, one of her biggest successes was collaborating to develop Vision Zero for youth. She was able to establish a youth strategy that put the wider community at the center of making routes to schools greener and safer. During the episode, we discussed Natalie's early life, the perils of cycling cross-country, and how reluctantly training to become a Taekwondo black belt taught her transferable skills that have shaped her approach to leadership. Enjoy the show. Our guest on the show today is Natalie Draisin. She is the director of the North American office and the UN representative at the FIA Foundation, the independent charity that aims to ensure safe, clean, fair, and green mobility for all, playing their part to ensure a sustainable future. Welcome to the show, Natalie.
Thank you. Thanks for having me.
Good. We always go back and talk about your childhood and kind of get our listeners a little bit of an insight into getting to know you a little bit better. So, I mean, in terms of looking back at your childhood, you were born and raised in New Jersey. What type of a childhood would you, if you were going to describe it, how would you describe your childhood?
Sure. I was very privileged to have a very comfortable childhood. I grew up in New Jersey, and when I think about my commute to school, very much was in line with car is your American identity, right? I lived 1.9 miles away from school, and the school bus wouldn't pick up if you were in a 2-mile radius. And I could have walked to school, but very typical of American suburbs, there were no sidewalks. So my parents drove me. And then when I turned 16, I got my car because that was, like I said, my identity and my freedom was my car. And I drove myself the whole 7 minutes to school. And I'm not proud of that. I wish I could have walked. I think it would have been a really good way to start the day and a good way to get some physical activity. And so I think that's, part of what drove me to make sure that my kid can walk to school and that other kids can too.
Yeah, definitely. And in terms of your, I guess your family makeup, the parents, so is your mother from France, right? I'm interested in kind of how that stacks up, culturally walking to school or maybe cycling, maybe in France. Would that be the norm there, or how did she view that kind of soccer mum commute, I guess?
Yeah, I often ask myself how my mom adjusted so well to a life that was very different. She grew up in a rural village of 250 people where our family has been making wine there and living in the same houses for about 11 generations. And I was very lucky. I got to go there every summer. And I kind of felt like I had a foot in two different worlds, right? I felt like another planet. It was a really stark contrast to my very nice, but very car dependent suburban hometown. And when I was a kid, there were only 5 channels on TV and there were cows in the streets and cheese was sold by horse and buggy. And I played with my cousins in the streets because the streets belonged to us and not to the cars. And it was quiet and peaceful and the air was clean. And I was really lucky that my parents took me to European cities with vibrant streets filled with people and outdoor life instead of polluting vehicles. And even as a kid, this just felt like a happier, healthier, more communal way to live. So it helped me understand kind of what safe and sustainable mobility could feel like, not just look like, really what it could feel like and how it could affect your life. And I loved any chance to do that in the US as well. So I'd go to New York City with my parents every weekend and we'd go to a street fair. And I loved back then and still really love that closing streets just to traffic allows for outdoor arts and culture and vendors and the opportunity for strangers to interact, because streets that prioritize people feel like a luxury, but they benefit our communities in so many ways, and they should really be available to everybody. Safe streets, I think, are a human right.
For sure. And I guess that experience as a child and growing up shaped your perspective really, maybe led to what you're doing now. In terms of your kind of school career into early career, you went to study public health. Was that all around active travel, well-being, or was it just more of a subject that called out to you?
My career path is one that really taught me that it is possible to land your dream job. As a kid, I was raised to be aware of the fact that I was privileged and that most of the world suffered challenges I was fortunate to never experience. Being raised in this way fostered a desire to help as many people as I could. In college, I learned that public health does just that, which is why I majored in it. I started to become involved in road safety because of a tragedy when a sorority sister was hit and killed by a drunk driver on her way to school. I didn't think that road safety was really a career path, though. It seemed too niche, too unattainable. So I worked as a leadership fellow with the Pew Charitable Trusts once I graduated, where I focused on children's dental Medicaid services. I really didn't know that lots of kids miss school because of things as preventable as cavities. It was a formative experience, but it really bugged me that I was sitting in a beautiful, expensive building, working on this issue without ever having set foot in a dental clinic, serving the exact population that I was trying to help. So I did a 180 and volunteered with the American Jewish World Service in Kenya, working and living alongside community health workers on issues ranging from HIV/AIDS prevention to microfinance and gender-based violence. And that was really a life-changing experience. It taught me to learn with humility and to truly value and defer to the expertise of people on the ground. It also taught me that there was only so much that I could accomplish without funding. So I decided to chase the money and go work for Accenture Consulting, where I thought I could have a bigger impact. Accenture was a really good boot camp on how to work with clients and provide value. But I knew that I wanted to follow my mom's very good advice to get 2 master's degrees by the time I turned 30. And the clock was ticking. So I did this because, she pursued higher education while she raised me. And I can imagine that that was really difficult. And she enjoyed the ability to switch from one area of expertise to the other thanks to having several degrees. So I went back to Hopkins to pursue my MPH MBA, very fortunately with a full scholarship. And I wasn't really sure what I wanted to do. Initially, I went back with the intention of pursuing international health. And I remember coming home one day and asking my boyfriend at the time, is it really possible to get paid to do what you love? You seem to love your job, so how'd you do that? And he gave me 2 very good bits of advice. First, go find the profile of the person whose job you want and network your way to that person. Pull the student card, ask them for informational interviews. And second, figure out what organizations you need to work for to get there and take advantage of being in school to do internships at those organizations while you complete your degree. This seemed like a lot, but I did that and I learned as much from my internships as I did from my classes. Oh, I also married my then boyfriend, and I think that helps too. When I was in grad school, I worked for the National Transportation Safety Board and the World Health Organization with the intent of pursuing global road safety after that conversation. And I networked my way to my predecessor, Bella Denzar, who had just been appointed to be a board member of the NTSB. So she was looking for a replacement, and Bella trusted me with her job. So that's really 3 bits of advice, right? First, use the student card, do those informational interviews. I got that NTSB internship through a cold call that I placed to the agency when I was collecting data for a paper in school. You really never know what's going to come of it, but you have to be courageous and pick up the phone and talk to strangers sometimes. Second, network. Good jobs really often aren't posted online, and great jobs are the ones where you are the one writing your own job description. And third, third, to the extent you can, chase your dreams. I say to the extent you can because I recognize that sometimes this is really hard for financial reasons or time constraints. But if you can find the time, do volunteer work in the field that you want to go into and then leverage that to find a way in. Sometimes if you look for the unorthodox ways to get there, you can find that path to your dream job.
I know we'll definitely circle back on kind of the infrastructural developments required, etc. But so yeah, one of the trends we kind of see on the show, and I know we're talking public health and road safety today, but that kind of ability to be able to combine data across lots of different sources and maybe showcase the impact greater than it is, if that makes sense. And most of us maybe working in silos and say, right, we're doing this sports initiative or this road safety initiative, but how does that impact the wider community, whether it's reducing cost on public services or NHS over here, or whether it's pollution. I wonder what your take is on that in terms of gathering the data and analyze it, especially with us looking from a software point of view as well. Now, I was going to say, do you use any tools in the foundation at the moment in terms of measuring the impact of some of the initiatives, right? Because you're doing so many. Mm-hmm. Is there a way that you kind of a key metric or metrics that you use across to analyze?
Yeah. So measuring data is crucial, right? If you can't measure it, then you can't prevent it. And one of the tools, I'll say first, we have tons of tools, right, to make sure that every child has a safe and healthy journey to school. And they're available at childhealthinitiative.org. And you can find them based on your time and resources and expertise. One of my favorites is the IRAP Star Ratings for Schools app. And so this is an app that schools can use, communities can use, planners can use to rate the infrastructure of schools through a lens of risk on a 1 to 5 star scale, 1 being the least safe, 5 being the safest. And it basically gives you suggestions for infrastructure improvements, and you can track those to make sure that they're making a difference and that they're cost effective. So that's a really powerful tool, right? Because you want to know what interventions are going to give you the greatest cost benefit ratio and going to make the biggest difference in reducing risk and reducing injuries and fatalities. And that is an easy way to do it. It's wonderful because it really puts the power in the hands of the user. You can use that to advocate for safer streets, and you have your solutions at your fingertips. But that's just one example. There's plenty of other ones, but I definitely believe that key to road safety and any other public health intervention is having that before and after data, and also constantly monitoring, right? Because we know that even after you improve that safety, people may catch up to it, right? And we're humans, we will adjust our behavior to take the easiest way. Yeah. So one of my injury prevention idols, Sue Baker at Hopkins, told me that the safest way has to be the easiest way. If you had a pedestrian crossing, for example, and a pedestrian bridge, people might not use it because they don't necessarily want to walk all the way to that pedestrian crossing. Mm-hmm. They might want to cross the street diagonally. And so we also have to evaluate people's behavior and how they interact with the street and what they want to do. There's another tool we have that we created with the U.S. Centers for Disease Control and Prevention, called the Traffic Conflict Technique Toolkit. It's also at childhealthinitiative.org. And it can help you collect observational data to understand near misses. So almost crashes, right? To understand where we're having the riskiest interactions with vehicles and how we can prevent that. That's just another way to make sure that we are behaving in a safe way and that our roads are guiding us towards safe behaviors.
Oh, thank you. Appreciate that. That was me going off on a tangent from just from my curiosity.
That's okay.
I mean, looking back, your journey after Johns Hopkins, obviously numerous kind of high-profile internships and positions, WHO and Accenture, etc. What did you take from those? I know there's so many, but what did you kind of some of the key insights that you took from those that you bring into your role with the FIA at the moment?
That's a good question. The biggest one is that we cannot operate in silos. Right. It might seem like the experiences that I had were disparate, but I can find threads connecting them for sure. Road safety is not just about road safety. It's about air quality improvement. It's about healthcare costs. It's about economic opportunities and access to healthcare. When I was volunteering in Kenya, for example, it was really clear to me that some people couldn't get out of the small rural village that I was in to employment opportunities in the city because the roads were so bad or flooded during the rainy season that it was just impossible to move. Mobility was not a possibility. Some kids struggled to get to school because it was so dangerous. All of these things are interconnected. Roads are really the veins through which the health and the economy of our society flows. But in that same vein, years later, when I ran into my boss from this rural village in the halls of the UNGA, which was, a mind-blowing collision of two worlds, they paved the roads around this rural village. And what happened was that road traffic injuries among the kids went up. People were speeding. And they had paved these roads, but they hadn't put in provisions to slow cars down and to make sure that pedestrians and cyclists, and especially our kids who are so vulnerable, could walk safely. And that was why we saw this uptick. So it's a question of all of these different silos not being silos, right?
Yeah,
Connecting,
for sure.
and also thinking about the ramifications, thinking ahead.
Definitely, it's
I'm
that
sorry, you were
behavior.
going to say something.
No, I was just going to say it's that behavior change piece. I mean, we see it in the UK. Fantastic initiatives around cycle training, we spoke about earlier on. But I guess what's required is kind of the training of the drivers as well, right? So if you're on a bike, you're learning how to ride in a certain way. And that needs to be reflected when people are being taught how to drive and they're doing their lessons. They need to understand what the cyclists are doing on the road, etc. I was just interested that behaviour change where you brought some of that experience from Accenture in terms of implementing things into organisations, but finding a consensus, etc. But I guess before we look at your journey to joining FIA, it might be good to the foundation just to give a bit of a synopsis. Really, I mean, FIA governing body for motorsport, etc. But if you could just expand on that for us, just to explain the relationship between the two, right? So I came across FIA firstly with, Formula One, as a child. That's where we've seen it first. But yeah, it'd be great for you to kind of outline that for our listeners.
Sure. So the FIA governs motorsports, as you said, Formula One. In 2001, they endowed the FIA Foundation with a $300 million grant. And the foundation focuses very much on safe and sustainable mobility, particularly in low and middle income countries, because that's where 90% of road traffic fatalities occur. That said, the FIA also works on road safety, and we often work together. They have auto clubs around the world who are also our members and who we work very closely with, and who have a powerful say in progressive agendas to do things like lower speeds, because they understand they play a role in keeping their communities safe. So we very much work together.
In terms of the scope, scope of the foundation, it's global initiatives, right? Working across the majority of countries. What would you say the kind of mission statement is for the foundation?
We really strive for a data-driven, evidence-based approach to reducing road traffic injuries and fatalities. Again, particularly in low and middle income countries, but also in high income countries. We do work here in the US as well that I can talk about. And we work collaboratively with our grantees, and the grantees they're the power of our work. I'm always in awe of how connected they are to the ground, how they really push the agenda, how they protect our children.
So with the FIA at the moment, what are the kind of initiatives that you're working on? And also the kind of structure of how, I know you mentioned the endowment and the funding, 300 million is a lot of money. Do you need to the organisations we speak to are kind of continuously fundraising? But I guess because of the partnership with the FIA, is the foundation almost like that's an area you don't have to worry about and you can just concentrate on doing the work?
Mm-hmm. We are really lucky that the endowment allows us to concentrate on doing the work, but our partners always can use more funding. So we love partnering with other organizations to co-fund projects. And even better if organizations aren't necessarily in road safety, focus on child health in general or other parts of child health. I think that's also really powerful collaboration, because then you get a more public health approach rather than just a niche approach. You asked about our main focuses these days. And one of them, which is really the foundation of all of our work, is to lower speeds. The WHO recommends that speeds should be 30 kilometers or less where children live, learn, and play, and that we should separate vulnerable road users from vehicles. The idea here is that kids really can't sustain the same impact as we can, right? If you hit a child at 30 kilometers an hour, that child might live, but any higher, and they probably won't. And I see in this country, I dropped my kid off at school today, right? It was the second day of school. And I looked around and everybody has an SUV.
Yeah.
And he doesn't even come up to the top of the wheel well of an SUV.
Yeah, I was going to say that must change I know you're saying 30 kilometers an hour, but does that change things with the type of vehicle and the size it must do something, right? It's got to be even slower with the SUV.
Absolutely. And, there's also ways to make vehicles safer for pedestrians, which is to say, if you hit a pedestrian, it depends where you hit that pedestrian as well, what their chances of survival are. So you can design the hood of a car so that a pedestrian would probably survive. Our partner, Global NCAP, does a lot of that work and makes sure that all countries have these sorts of standards, not just high-income countries. So we have to make sure that everybody has access to that. But, you had asked about our priorities and low speeds. Low speeds also have cross-cutting benefits for air quality and physical activity. And that's why we began the Streets for Life campaign, which garnered global support for the WHO recommendation for low speeds during UN Global Road Safety Week. And this is when leaders around the world, including mayors and heads of public health organizations, signed on. And the website's still up. It's unglobalroadsafetyweek.org, and it has lots of tools to ask decision makers to lower speeds, because lower speeds are the way that we prevent the biggest killer of our young people, which is road traffic injuries. And, with the pandemic, this is a different conversation now because we have more political will and public demand for safe outdoor spaces. It's how we avoid getting COVID, and it's how we maintain our mental and our physical health. And we need these outdoor spaces. Our kids need them even more. And it'll be a little while until all of our kids are vaccinated, meaning they're going to face two challenges on their way to school, right? COVID and road traffic injuries. But fortunately, there are low-cost solutions that address both risks. And they're highlighted in this guidance that I wrote last year with UNICEF on how we can keep our kids safe from COVID and road traffic injuries on the way to school during the pandemic and beyond. And they're also highlighted in guidance that we and our partner, National Center for Safe Routes to School, just put together with the Department of Transportation, CDC, American Academy of Pediatrics. And that's visionzeroforyouth.org. There's a section called Back to School, and you can click on that. And the solutions are really simple and inexpensive. We can create space for drop-off and pickup, close down all or part of the street, or use natural and repurposed materials to help kids line up 6 feet apart. Some schools use remote drop-off, so they're like kiss and go zones, so parents can drive their kids to a location near school, and then kids can walk together the rest of the way. And that also helps reduce air and noise pollution around the school. And I know you're in the UK. London has a school streets initiative that closed traffic on the journey to school, reducing emissions by about 23%. And 81% of parents and caregivers support that measure. And also, that air pollution raises the risk of COVID-19. So this has lots of different benefits. And, students play such an important role in improving their own safety. So a great thing to do is to do walk audits with kids. In Mexico City, our partner ITDP does this through their Vision Zero for Youth initiative. And they worked with kids to improve the safety of the road around school. They taught them basic road safety, and they asked them what kind of streets they wanted to see, right? Because it shouldn't just be for us without us from the kids' perspective. It should be for us with us. And even the youngest students could voice their opinions just by walking around with like a paper magnifying glass, red on one side, green on the other, show what they like and don't like. And they can play an active role in redesigning the streets. You can imagine that's really empowering. If they go out and they even just paint curb extensions or road narrowing, and then they can say, I did that. I helped protect myself and my peers. I think that's a really important way to see future road safety leaders as well.
Yeah, no, I love that walking audit initiative as well. I think that definitely would be a good fit for the UK. There's all this guidance and all the information. Who's it really aimed at? Is it anyone? So could I, as a parent, pick this up and take it to my school, or are you targeting, I know I was going to talk about the grantees as well, but are you targeting kind of a certain level of government, national, regional? Is it the school principal, or is it just open for everyone to access?
So the guidance is open and available to everybody. That UNICEF guidance in particular does have a checklist for school administrators, parents, decision makers. So if you don't want to read the guide, you can skip to the end and check out the checklist. That's kind of your cheat sheet for what you can do. The US guidance similarly has different features that are accessible to everybody, and examples from around the country that I think are also applicable elsewhere in the world. So they're definitely accessible. And then, the whole premise of the Child Health Initiative that the foundation hosts, again, is that every child should have a safe and healthy journey to school. You don't have to be a grantee to make sure that your children can do that. So on this website, thechildhealthinitiative.org, we have a toolkit with resources for everybody to be able to help ensure that for our children.
Recent guest of ours was Emily Cherry from the Bikeability Trust over in the UK. They're working towards essentially getting cycle training on the curriculum, so every child has the right to access cycle training so they can be more capable and confident on the road. Is there a kind of an equivalent of that initiative in the US, or I guess globally as well, starting with the US though?
Yeah, I listened to her interview, and I hope everybody else listening will as well, because it was very good. She was inspiring.
She is.
There are very few comprehensive programs that teach kids in an entire community to cycle. Unfortunately, in the US, that task is really often left to parents. And I find myself starting to think about that as my child turns 2, and how can I get him on a bike safely? But there's one great example in Washington, D.C., which teaches all second graders to ride a bike. Their program's called Biking in the Park. It's the first large-scale elementary school program of its kind in the US. And through strong leadership and local partnerships, they very quickly put together a popular and successful program. So at the beginning, most second graders couldn't bike independently, but at the end of it, most could bike to a community destination. Before the program, there were reasons why students weren't learning to ride. So families couldn't afford the equipment, neighborhoods lack safe places to learn to ride, and students don't have anybody to teach them. This approach seemed to work. And around the world, we've seen examples of how to overcome those challenges, which are repeated globally. During the pandemic, India created something called the Cycles for Change Challenge, and that included community bike loans to make bikes more available to those who couldn't afford them. In Addis Ababa, Ethiopia, they created space for kids to learn to ride by using car parks because they weren't really being used during the pandemic, and they closed them down and opened them up to kids so they could learn to ride. Also during the pandemic, Milwaukee, Wisconsin, here in the US, hosted a summer bike camp and retooled the Safe Routes to School program into a Safe Routes from Home curriculum.
No, I was just going to say, I guess that's one positive, short-term positive you could take from the lockdowns and the pandemic is I'm sure the road safety stats have improved with everyone, with all the cars off the road, etc. So just an observation. But yeah, you were going to say about Bogota.
Sure. In Bogota, Colombia, there's a walking and cycling school bus program where a designated adult can lead kids on a safe path to school. And over 6,000 kids from 100 different schools benefited from this, as well as reduced speeds around schools and public spaces to encourage kids to walk and cycle. And we talked about how low speeds are so key to that. So Addis and Milwaukee and Bogota received our Vision Zero for Youth Award, which we run with our partner National Center for Safe Routes to School. And we co-founded Vision Zero for Youth because we recognize that children can really be the catalyst for wider Vision Zero approaches. And Vision Zero plans always have to include children, not just as recipients of education, but really through infrastructure and low speeds that protect them. But all too often, this really isn't the case. We just pay our kids lip service through our plans. We don't actually have infrastructure that helps them. So we really see starting with kids as a necessary and a smart strategy. I mentioned road traffic injuries are the leading killer of kids ages 5 to 29 around the world. And that's a lot of lost education and lives unlived and lost productivity, not to mention serious injuries. And it's hard to say no to protecting kids. And doing so really benefits the whole community. So if you picture a map of your favorite city, right, and your schools in your favorite city, you draw a 2-mile radius around all those schools, you'll see how those circles all overlap.
All join up, yeah.
Yeah, that's how safe routes really protect the entire community.
I was going to ask you around kind of your vision 5-10 years out for the foundation and the work you'll be doing. And I'm interested in technology, and I really wanted to ask you about self-driving cars, right? Because you're talking about if you want to reduce that DUIs or drink driving, so self-driving cars going to remove that straight away. So I guess what's your take on that in terms of automation, and then I guess how that's going to shape the work that you're doing moving forward?
Sure. Self-driving cars will be wonderful, but we're still a while away from them, particularly in low and middle income countries, again, which are bearing the brunt of the burden. So while I think it's important to pursue the benefits of self-driving cars, I think that we have to do so in a way that we know that they can be deployed in an equitable fashion. Johns Hopkins, our partner, is working on this, exploring how self-driving cars will help connect people, for example, in low and middle income communities with healthcare, how we can make sure that that is part of the conversation, because they're not a solution if we're not going to use them in a way that we can address the communities that are bearing the brunt of the burden. Like I said, they're a while away, so we have to focus on the solutions that we have,
Yeah.
right? And what we have are low speeds. We know that low speeds are like a vaccine against road traffic injuries. We know that 30-kilometer-an-hour policies save lives. And more importantly, we know that infrastructure that really helps people slow down and guides people towards safe behavior on our roads are key to saving lives. So while we, think about self-driving cars, I think we also need to really deploy what we have available at our fingertips today. I will also say that ever since, in college, my friend was hit and killed by a drunk driver. I've been obsessed with this technology called DADS, the Driver Alcohol Detection Safety System. And what DADS is like a passive breathalyzer in your car. So if you got into your car and you touched the steering wheel or just breathed as you normally do, and you were drunk, your car just wouldn't let you drive it. So my dream is to have a day where DADS is in all cars. And if that happened, we would eliminate drunk driving.
Sure. Operationally, obviously leading the organization in your role as a leader, what do you find are your kind of main recurring challenges? I know we spoke just off the record before about kind of your sporting background in Taekwondo and being the only girl in the room. And I guess that pulls through to today, right?
Yeah. So 2 things. When I joined the foundation, I was a little younger than I am now. It's been 6 years. And I was often, and still am, often the only woman in the room. This goes back to what we were talking about earlier. It was hard to feel comfortable speaking up. And it was hard to feel like, even though I was young, I still had something valuable to say and expertise to share. And being the only woman in the room is even more intimidating in some ways. But one of the things that I think helped me was that when I was in kindergarten, my dad made me enroll in Taekwondo. And I hated it. I hated it so much. But he made me stick with it until I got a black belt. And I was the only girl, and that was part of why I hated it. It was just uncomfortable. But it taught me to hold my own and to have confidence despite that discomfort, or at least play it off. That was helpful to be in a competitive environment, in a competitive sporting environment, while being the only girl. And now I'm really happy when I drive by the Taekwondo spot in my town where I see like a gender balance for sure. The other thing that from a less personal standpoint, one of our definite challenges is the lack of political will to address road safety. It's seen as something that is expensive, but we know that cost benefit ratio is there and it pays off. And it's sometimes seen as something that's not urgent, right? Fair enough, right now we do have an urgent pandemic on our hands. But the truth is we've had this epidemic on wheels on our hands forever, right? There's 1.35 million people who die every year and 20 to 50 million more who are injured. We can prevent all of that. But it's so hard to make that case sometimes to politicians who have other, sometimes more pressing things on their plate. Again, I think the pandemic is helping people realize that this is important, and it's also helping stir up the public demand to do it.
Do you think it's because it's tied to our kind of individual freedom? I can't take my car away from me, I can't make changes like that. And then the impact, if I'm the governor or the president who put this in place, took our freedoms away in terms of lower speed limit, etc. The politicians are worried about the backlash, I suppose, if that's relevant.
Absolutely. Speaking from an American perspective, we love our cars and we associate them with freedom, and we love driving fast. And that's why we just saw that we've had an unprecedented spike actually in the first 6 months of this year, where fatalities are up again, despite less vehicle miles traveled, because people are speeding and because people love speeding. This is just part of our American identity. So it makes it really hard for mayors to implement low speeds and to advocate for that. But when you see the public really rallying behind this, and especially behind protecting our children, it makes it easier for politicians to act. So, I just saw Paris is implementing slow streets around schools. And much earlier, the mayor had said that Paris will never look like it did pre-pandemic, because now there's going to be more cycle lanes. The public loves them. It'll be more walkable. So people have gotten a taste of what that looks like because of the pandemic. So I really think we're at this tipping point where the public understands it. It makes it easier to have the political will, and we're seeing the cross-cutting benefits. I think it's a really exciting future ahead for road safety for that reason.
Yeah, I've seen a lot of initiatives, I think maybe throughout Europe, kind of, like you said, closing the streets or pedestrianising certain areas as well, and kind of using the streets as something else or making it feel like something else. So yeah, it's really, really exciting. From all of your experience working in all the different organisations that you've been in, have you developed any approaches to leadership? So you've probably seen a lot of leaders and worked with a lot of great teams. Is there anything that you've pulled from that to kind of develop your own philosophy on leading?
Sure. The two big things that come to mind are, one, serving with humility, I think is always really important. And two, asking questions and being okay with saying, I don't know. And particularly if you're working for a foundation, assuming that your grantee knows more than you do, because they do know the situation on the ground much better than you ever will. And respecting that and working hand in hand with them, I think, is crucial. I remember when I was volunteering in Kenya, I showed up to this rural village, was working on HIV/AIDS and gender-based violence with these community health workers. And I asked this woman on my first day if she was okay because she had a black eye. And she said, yeah, I'm okay. My husband raped me, but I'm all right. And I said, oh my gosh, did you call the police? And she laughed at me and said, no, of course I didn't call the police. They would just rape me again. I just went home to my parents, and then I'll go home to my husband and start all over again. I came with this assumption that you call the police because that's what you do where I'm from. But that's not what you do in this rural village in Kenya. And obviously that needs to change. But had I worked on that issue of gender-based violence from abroad and imposed my belief on what I thought was a solution, without understanding it,
you started calling the police and making more issues.
That would be right. Or designing a policy solution or intervention where it's very police focused, I would have probably caused more harm than good. So I think truly getting to know the people that you work with and truly deferring to their expertise, deferring to their experience, and understanding where they're coming from is important, not just professionally, but also personally to me.
Well, for sure. I mean, in terms of your, we're always curious and want to hear about people's daily routines and habits, things like that you do. Obviously, it talks about the school run, etc. But from a personal point of view, is there anything that you put in place to stay on top form, and some things that are kind of non-negotiables you need in your day every day?
Yeah, I love sleep.
If your son's at school now, you might get the sleep back to normal now.
Yeah, we sleep trained early because it was always a priority for me, for us, for everybody. So fortunately, we've been sleeping, knock on wood, for some time. So that priority, probably the two biggest things that I do in terms of self-care, if you want to call it that, are getting a workout in every day and getting outside every day. This is really important for me because I work from home. And I have worked from home for some time. In the beginning of my work with the foundation, I was traveling about 70% of the time. And then the pandemic happened and I was home all the time. So to feel sane, I do like a half an hour workout video while watching TV. And I make a point of getting outside every day, often with my son, watch him play. That's really critical. And just connecting with neighbors or the community is so important. Before the pandemic, I went back to teaching spin classes, and I loved that. It was a great way to get out there and get to know people and be collectively energized, and I miss it. So I hope to go back to that at some point. But I think physical activity every day is a must for everybody.
Yeah, get the endorphins moving. Especially, I mean, it can be really isolating as well, working from home. Everyone's going
Yep.
through that at the moment. Even though you're kind of seeing people, but you're
Yeah,
missing the interaction of being in person and getting that energy.
exactly.
One of the stats that you shared with us as well before was that the percentage of children who are walking to school, US compared to UK, look like quite
Mhm.
fast. And we do have kind of certain initiatives over in the UK, like the Daily Mile and things like that. Where we're trying to get children active in the morning, but they're a bit more structured in terms of on the school site. So yeah, I don't know if you've got a take on walking to school and how that benefits children's performance and well-being.
Sure. Well, I think, so many groups are working together to support increased physical activity. Many are your listeners, so I commend them on that. And given the real drop that we saw in physical activity during the pandemic, it's more important than ever to work together, whether it's supporting more walking and biking or phys ed or organized sports, because we want to give our kids the chance to be outside and to play and to reconnect with the community and to safely interact with others, right? This is so important right now during the pandemic. All physical activity, including walking or cycling to school, has tons of benefits from physical to mental health to academic achievement. And almost right after engaging in physical activity, kids are better able to concentrate on classwork, improving their ability to learn. You can imagine the benefits when kids show up to school after walking or cycling. They arrive ready to learn because there's a really direct connection between physical activity and brain development and cognitive function. And there's long-term benefits too. Physical activity reduces the risk of obesity and diabetes and stress and depression and low self-esteem, which I think a lot of kids are grappling with, particularly now with the pandemic. And it's associated with higher levels of cardiovascular fitness. Just recently in 2019, Cambridge University issued a report saying that promoting regular participation in sports as well as active commuting to school could be a promising way to combat childhood obesity. But still, most children and adolescents don't get enough physical activity precisely during the best time in their lives to develop those healthy lifelong habits. And this is really where schools come in. Kids spend so much time there. So schools can play a really unique and important role in our kids' health by helping them to get physical activity. And that's why the Institute of Medicine called on school leaders to offer more opportunities for kids to be physically active before, during, and after the school day. So walking and cycling to school is a really great, fun way to just conveniently sneak in that physical activity with lots of other benefits like lowering air pollution, because it shifts us away from car dependency.
Yeah.
And schools in low income and minority communities have a really important role because childhood obesity and poor academic performance is often prevalent in those areas. And physical activity can play a role in reversing. So again, at the foundation, we host the Child Health Initiative, and it's founded on the premise that every child should have a safe and healthy journey to school. And that's why childhealthinitiative.org has a toolkit so that anyone can work towards that in their community. There's lots of tools and examples for different levels of resources and time and expertise. And I hope it's helpful in helping us all reach that goal.
Definitely. I think our listeners as well, a lot of them over in the UK here, that a lot of them provide services to schools, and that funding, school has to choose between what they spend their money on, but also showing that the beneficial impacts is not just sports, and showing that if you were to be physically active early in the morning, that would impact on the academics. Because a lot of schools in the UK will choose the morning to do numeracy and literacy, right? That's kind of a standard across the board. Whereas maybe if you did some physical activity, walking to school would be great. Maybe something a bit more energetic as well. If you're able to evidence the impact on the academic performance, that's really positive. People who want to work with schools and kind of access some of their funding. So again, those resources that you pointed out, they'll be really well used by a lot of our listeners and the wider community. So thanks. Last question for me, and we always kind of close out with this one. Can give yourself some advice. If you go back to yourself before you started your career or when you're in college, maybe what one piece of advice would you give yourself if you could just go back and give one gem of advice?
There's three things. Take risks, opt for experience rather than prestige, and don't let people push you down. So taking risks. The most formative experiences that I had were the ones that scared me. Whether it was volunteering on an Indian reservation at 16, or biking across the country at 21, or living in Kenya at 23, those experiences really pushed me beyond my comfort zone, and they forever changed my perspective on life. They helped me discover parts of myself that I would not have known otherwise. Now, I'm not saying that you should take unreasonably dangerous risks, right? You have to weigh them responsibly, but take the ones that you can, and take advantage of being young and not being tied to one particular place or thing or person. The second one is opt for experience. The experiences that helped me grow were really the ones where I was given responsibility, maybe even more responsibility than I should have had. From running my college public health journal to being a reporter for my local TV news station because they were short-staffed, I learned the most when I was given room to grow and also room to fail, right? Those were the experiences that I rely on most to this day. And it's not as much the experiences that I had at the organizations with the name recognition. So take advantage of being young, again, to put yourself in a position where you can comfortably fail and use that as a learning experience. And the third thing is an important one. Don't let people push you down, because along the way, people will try to push you down. And my first boss was hopefully the most challenging one that I will ever have. She actively tried to prevent me from succeeding and from growing. And rather than letting her negative perspective hold me back, I learned from it and I became a stronger professional and person in general. I also learned how not to lead. So I think the best way to overcome an experience like that is to really use it as a foundation to succeed. And the best way to get back at a boss who wants you to fail is to excel.
No, I love that. Natalie, thank you so much for your time. I really appreciate if you chatting with us today. Everything we've mentioned as well, so great insights, and those the resources and the websites you mentioned. We'll link all of that in the show notes for any of the listeners who want to access those resources. But yeah, I just want to say a big thank you from us, and thanks for your time.
Thank you. Thanks for having me.
Thank you for listening to this week's show. You can subscribe anywhere you get your podcasts. If you'd like to get in touch with us, you can write to us at drivephase.podcast@coordinate.cloud, tweet us at coordinatesport, or follow us on Instagram at coordinate_sports, or on my account at James_ventures. This episode was produced by Nancy Kwamboka, with support from Claire Goodchild and Lola Small, with special thanks to Rochelle. I'm James Moore, and you've been listening to The Drive Phase from Coordinate Sports.